everybody. My name is April Demito. I'm going to be your professor for the next 12 weeks, and there I am down in the corner there for Nursing 667. And this is our video announcement for the week. I typically do a video announcement every week. The first one is a little more extensive because I go over the course content rather. I think you'll find that I communicate a great deal with students, and any advice for success is to check your email on a daily basis. It only takes a few minutes, and you might miss something because I communicate a lot. Sometimes, especially in the beginning of class, every day. So let's see. We are in Nursing 667, and this is my dashboard. You can see mine looks different than yours because I have a couple classes that I'm teaching this term. So they may be a little different. And something I want to go over a little bit with you is the course calendar. I hope that you are, this is not a new concept to you, as professors should be using the course calendar. But if it is, I'm going to give you some um, orientation to the course calendar, I guess you could call it. I have all the course plotted out for each week. So you'll know exactly when assignments are due, when things need to be turned in, when exams are, when papers are due. So plan ahead. Today's week 1, and this week is actually a little light for you. You just have your introduction forum to do. Now you can see my calendar is pretty busy. I've got a lot of stuff because I'm teaching right now 4 classes and 5 starting in September. Yours isn't going to look like this because you're only taking the one course. So you can see your introduction form is due on the 23rd, and then we go to week 2. Week 2 starts your first real assignment, which is going to be a case study, and your case study is due. We'll go over that more when we get into looking over modules. I'm just going over the calendar right now. Now, when I was looking over the course content, I really like the way this course is laid out. It's the first time I'm teaching this course. It's organized quite well, so I think you're going to find it very student friendly. Now, with a case study, you have each been assigned randomly to a group, and that group has been assigned a case. Now, it is each individual members of the group or member of the group's responsibility to complete and answer all of the questions regarding that case. So this is not a group project where you get together and I'm going to answer question 1 and 2, you answer question 3 and 4. It doesn't work like that. Every member of the group is responsible for answering all of the questions. The group part comes in with the discussion. So whether there are 3 in your group, or some of the groups are kind of small, because I've got, out of the 2 sections, one of the groups is quite small. You're going to discuss the case amongst each other. And all of those discussion post responses are due on Sunday, the 3rd. So any credit you get, it's got to be by midnight the 3rd, otherwise you're not going to get credit. Now, when you look, it says that the minimum requirement is 2 responses, right? Well, I expect if you want to get full credit, you got to go a little above that. So if you want to get full credit, you're probably not going to get it if you just do 2. Plus, the post's grade is dependent on the content. It has to be quality content with substantiated resources and very thoughtful. It's not enough to write in there, I agree with your diagnosis completely. That isn't going to work. So I want you to put some thought into this. Now let's see. As we move forward, we've got another case study. I was looking at all of this content over the last couple of weeks. Well, actually, I was given the course last week, so I've been looking at it for a week. And I really think that your toughest week is going to be week 5 into 6. The reason being that week 5, you have, let's see, I passed it. Oh, I passed it. I went too far. So I want to go back. All right, so here we go. Week 5, you have your case study. And, uh-oh, I went back way too far. Oh, In my impatience, I went all the way back to June. That's not something that I want. Okay, here we are back in August. Back. All right, so where we are, week 4, you have your case study, your response. Week 5, and then here we go to, oh my goodness, I keep pushing too many buttons here in my haste to my slow internet today. All right, so here we go. Uh, Week 5. All right, so you have this right here. You've got a paper due, right? So this is your primary care paper is due that week. And then you've got your midterm exam that comes up that week. So, and you have a case study. It doesn't want to come up. Treatment plan. So you have 3 things coming up that week. That's a lot. So you need to plan ahead. And I'll give you an example of planning ahead too. I knew that I had to be on top of things, get everything ready for my courses this week. So, and I'm in not graduate school. I am getting my doctorate degree, and I had 2 big papers due on Sunday. Well, I knew I had to get them done in order to devote time to give this course uh, my the presence that it needs. So I ensured that I had all my paperwork done well in advance, submitted it, and bam, I didn't have to worry. So that I could devote all the time I needed to getting this coursework ready. So I expect you to do the same thing. You know well in advance that week 5 and 6 are going to be tough weeks. So get that stuff done as soon as you can. Now, with your midterms, you guys have your tests proctored. And this is my first term with proctoring. I do know that you have to set up and sign up to do it. And that should be like the first thing that you do. We're all adults, adult learners, nurses, some mastered prepared, some almost there. So it's not going to be good if you call me up on the 30th and say, April, I forgot to sign up for the test. Because that's going to mean, oh gosh, I'm really sorry. There isn't anything I can do. You'll lose those points. So don't even think about it. Just do it. Just sign up for that midterm so that that's one less thing off of your to-do list that you have to worry about. Now you're going to find that every week I make little videos like this most of the time, not every time, not every week. It's dependent on the course content. I'm also going to make some videos for you that are related to the PowerPoint presentations. So as I said, I am an over communicator. So if you want to be on your game, you need to check the announcements and your email on a daily basis so you don't miss anything. Now, this course is set up really well. I'm very impressed with it. You have your course resources here, which is the first thing that we're going to take a couple minutes to look at. And with the course resources, there's a faculty bio in there, so it tells you a little bit about me. Prayer requests. The one thing I really want you to avoid here is the questions for instructor link. And the reason I say that is I want you to ask me questions. Absolutely. But not through this link. I want you to email me. I spend a lot of time seeing patients. I'm a full-time nurse practitioner, and I do a lot of my coursework in between patient visits on my smartphone. So in order to get your um, concern answered quickly, send me an email. If I have not answered that email within a couple of hours, in all likelihood I didn't get it, or else it got lost in the sea of emails, send it again. If I don't respond to you after that second email, then I want you to text me. Make sure that you include your name and the course that you're taking, and my contact information is in my bio. As we go down, we see APA format resources. There's some great ones in there. Purdue OWL. I kind of cheat. In my DNP program, I purchased the Perla software. It makes it a little easier. It stores all my references, so when I go to do my DNP project, all of my references are already in, so it makes it a little easier for me. You may not need to go to such extremes. and the resources there will be adequate for you. Now, here we have Examity, and that's how you're going to sign up to take that test. Do it today. And then we start out with modules. All of these courses are set up very much the same. It starts out with that module overview. So we'll go into the module overview to see what we have here. And it begins with our daily devotion. So if you click on the daily devotion link, it's going to take you to a page where the reflectinggod.com page. And this is a page that you can submit prayer requests. It has different scriptures in here that may be helpful to you. Um, and so that's open to access all the time. Then we have our overview. The first week, we're focused a lot on disease prevention, health promotion, and nutritional disorders. And we've got some information here. We have our objectives and the readings. We have some presentations here and assignment. The first assignment is that week 1 class introduction forum. I strongly advise you to go into these links that are here for you because um, they look to be quite helpful. I'm going to go to next. And we have our daily devotion, and that's to that site. I might be doing some stuff with this website because I have fun playing around with those sorts of things, so we'll see. And there's your introduction forum, and we've had lots of people who have already started to participate, which is a wonderful, wonderful thing. I'm going to go over to modules now because this is just a little easier way to access things for me. And your view may look a little different than my view. Okay, let's see. I want to go to week 2. Yes, here we go. The week 2 and module and devotion. I'm going to go right to this case study here, the case study discussion. And the unfortunate thing is, this is my first time where I have been playing around with the groups, and I have randomly assigned everybody to a group. But I had a student send me a message today saying they couldn't see it. So I'm going to have to go in there and fiddle around and see what I can do to fix it. In the meantime, I think this week I'm just going to send out an email to you all and let you know what group you're in and what case study topic you have. Now, this week we have 5 different topics, and because of the student base, we may not be utilizing all of these, so don't worry about that. You're just responsible for the one that you've been assigned to and answering these 6 questions. And remember, each individual member of the group is responsible for answering all of those questions. It is the discussion amongst your group members after that part is done that makes this a discussion group. Okay? So I think the big thing that I need to do is try to figure out how I can make those discussion groups visible to you, because that's a big piece. And there are no leaders of the group, so I don't do my sessions that way. Now, as I said, I communicate a lot, and you're going to see that there's a option on the side here called conferences, and I'm going to see if we can utilize that to have some informative sessions online. And also, I'm going to be doing reviews. So we'll do a midterm and a final review. We use Adobe Connect to do that. And I'm going to you see that there is a study guide here on your Canvas page, but I'm going to actually open up an opportunity for you all to join on Adobe, and let's do a review session on the course content. There's a lot of content that we're going over, so let's narrow it down a little bit. Also, I'm a practicing nurse practitioner. I've worked for 10 years in acute care, family practice. And before that, I did 18 years in women's health. So it's nice to talk about the different patient interactions and treatment modalities that are current and out there. And I think that it will help to bring us together between professor and student. So that's all I have to say right now. I'm going to, my task today is now to try to figure out how to get you all to see the groups that you're in for those case study discussions. So I'm going to sign off now and don't forget to, if you have any questions, please send me an email. Have a good evening.